Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Sputum. Sputum is actually the mixture of tracheobronchial secretions. All the tracheobronchial secretions together are expectorated out as sputum. So it contains tracheobronchial secretions. It also contains the cellular debris also. It also contains microorganisms and saliva. Once the sputum is released by a person, we should see the amount of sputum, we should assess the color, chronology, consistency, and the smell of the sputum. The main differences which are seen between the saliva and the sputum. Saliva mainly contains the squamous cells. Saliva contains the squamous cells, whereas the sputum contains epithelial cells. Because saliva is produced from the mouth, whereas sputum is produced from the tracheobronchial tree and the lungs. So, because the sputum is produced from the tracheobronchial tree and the lungs, so the tracheobronchial secretion, so the epithelial cells in the tracheobronchial tree and also in the lungs, those are seen in the sputum. So, if the sputum contains epithelial cells, along with the epithelial cells, if the sputum contains eosinophils also, if the sputum contains epithelial cells with eosinophils, then we should always suspect bronchial asthma and allergic bronchopulmonary aspergillosis. Then, amount of sputum. Based on the amount of sputum, we can diagnose the cases also. So, if the sputum, when the quantity of sputum is more than 11 ml per day, then it is called as bronchoria. If the quantity of sputum is more than 100 ml, if the quantity of sputum is more than 100 ml per day, then it is bronchoria. So that means there is a lot of sputum production is there. So this maximum or a huge amount of sputum production by a person is called as copious sputum production. So this copious sputum production is seen mainly in conditions like bronchiectasis, lung abscess, emphysema rupturing into the bronchus, necrotizing pneumonia, and alveolar cell carcinoma. So, in bronchiectasis, lung abscess, emphysema rupturing into the bronchus, necrotizing pneumonia, and in alveolar cell carcinoma, in all these conditions, we see copious amounts of sputum are seen. This copious sputum production will change with posture in certain conditions. So, change of copious sputum production, which will change upon posture, includes mainly the bronchiectasis and the lung abscess. In bronchiectasis and lung abscess, the sputum production changes with the posture of the patient. Then large amount of colorless sputum is seen in alveolar cell carcinoma. In alveolar cell carcinoma, we will see large amount of colorless sputum. Then chronology of the sputum. In the chronology, first in chronic bronchitis, the sputum is more common in the early morning hours, whereas in bronchial asthma, the sputum can be either in the morning or at the night. It can be either in the early morning or at the night. And if the patient has no sputum for a longer period of time and suddenly if he develops sputum, then always suspect severe infection. Infection will exacerbate the sputum production. Then, based on the color of the sputum, we can even diagnose the disease. So, in the color of the sputum, green colored or yellow colored thick sputum are seen in bacterial infections. Why? Because green colored or yellow colored sputum is due to the enzyme called as myeloperoxidase. Due to this myeloperoxidase enzyme, we see green colored or yellow colored sputum is seen. Then black colored sputum. This black colored sputum is mainly present in coal workers pneumoconiosis. Then we have rusty sputum which is present in pneumococcal pneumonia. Red currant jelly sputum is seen in Klebsiella pneumonia. Pink frothy sputum is seen in pulmonary edema. Blood stained sputum is seen in tuberculosis. Anchovy sauce appearance of the sputum. Anchovy sauce colored sputum is seen in ruptured amoebic liver abscess. So these are the different colors of the sputum. Then Consistency of the sputum. The sputum can be either a serous in consistency. If the sputum is serous in consistency, that is, the sputum is clear, watery consistency, it is mainly seen in bronchoalveolar carcinoma. If the sputum is clear, watery, and frothy, and it is also pink in color, then it is seen in pulmonary edema. If the sputum is mucoid in consistency, mucoid meaning if the sputum is clear, grayish white, and if it is frothy and sticky in nature, if it is sticky in nature, then it is seen in chronic bronchitis and chronic asthma. If the sputum is mucopurulent or purulent in color, that is because of yellowish. If the sputum is mucopurulent or purulent, purulent meaning that there is pus is present. So if the sputum contains pussy nature or yellowish green brown sputum is seen, then it is seen in bacterial infections. If the patient has bronchial asthma, in bronchial asthma there is sputum contains some important characteristics in bronchial asthma. In bronchial asthma, the sputum mainly is consists of eosinophils, desquamated cells. It consists of Kirchmann spirals or charcot-laden crystals or Crayola bodies are seen in sputum with bronchial asthma. Charcot-laden crystals are the crystalloid debris of eosinophilic membranes which are seen, and Crayola bodies are exfoliative cells which are seen. Actually, this charcot-laden crystals are eosinophilic membrane protein, and the protein which is present in this charcot-laden crystals is actually galactin protein is present in these charcot-laden crystals, whereas Crayola bodies are the exfoliated cells which are seen. These are actually the epithelial cells which are exfoliated due to the loss of the mucosal integrity. Then odor of the sputum. The odor of the sputum is offensive or fetid in conditions like lung abscess, bronchiectasis, and anaerobic bacterial infections.
Thank you and thank you for watching.